It's fantastic to be invited here today to have the opportunity to speak to you. And I'll just, if you can see it, I'll just flick onto the book here. I don't know if you can see that was the book I'm going to talk about. So I'm a health psychologist from the University of Nottingham with an interest in work and health. And as you can imagine, this is a topic area that's gained a lot of traction since the COVID-19 pandemic, when the need to focus on staff wellbeing became very apparent across the UK and globally. And working very closely with Gemma Stacey from the Florence Nightingale Foundation, we've edited a book called Health and Wellbeing at Work for Nurses and Midwives, and it was published by Elsevier. And if you've not seen it already, I'm really excited to introduce this book to you that's got contributors from across the UK and beyond. If I could just have the next slide, please. There we go. Thank you. There's no doubt that fostering a healthy and happy workforce is good for everyone. Health and wellbeing in the nursing and midwifery workforce has long been a consideration, but it's not always been prioritised. With concerns about the retention of early career and established healthcare professionals rising, we're seeing an increased commitment to systematically addressing the factors that influence and undermine health and wellbeing across health and social care environments. So in this text, we're providing practical and accessible guidance to nurses and midwives on how to manage their wellbeing at work. And we're proud to have coordinated the input of 36 contributors with expertise in nursing, midwifery, in workplace health and psychology, who've offered their insights informed by theory, research and policy. And we hope this book is going to be helpful to individuals who are looking to enrich their own wellbeing and experiences at work and those of their colleagues, to team leaders who are committed to creating team cultures and working environments that foster wellbeing, and also senior leaders that have the power to influence policies and practices within organisations that have the potential to embed wellbeing into the fabric of the clinical environment. So the style of writing is largely conversational so that we can make it accessible. And the chapters are purposely short and focused, ending with 5 key recommendations and a practical activity to help readers to translate their learning into practice. And we've put in case studies throughout that offer examples of strategies that have been successfully implemented to support and enhance wellbeing of the workforce. So what I'm going to do now is just going to run through the structure and outline of the book for you so you can get a bit of a feel for what it's about. Next slide, please. So in section 1, the case for health and wellbeing at work, here we're outlining the cost of ill health to employers, and we provide a business case for organisations to invest in wellbeing by outlining the cost to employers of ill health in the workforce. And we offer perspectives on the way in which health and wellbeing can be impacted by the health and social care environment and the nature of the work that midwives and nurses engage in on a day-to-day basis. And within this section, we demonstrate why health and wellbeing needs to be a primary consideration for employers in terms of the impact of health and ill health on individual workers, on the workforce as a whole, on the organisation, but also how it impacts on the quality of care that nurses and midwives can provide. So in this section, we've got a number of chapters: why healthcare employers should promote health and the costs of ill health at work, caring for yourself to care for others, prioritising self-care, how staff wellbeing relates to patient experiences of care, how stress and anxiety affect the body, and understanding compassion, fatigue and burnout. I wanted to share with you an extract from chapter 2 that was written by my colleague Joy Darch, who's a retired nurse and academic from the University of Gloucestershire. And it's an introduction to her chapter, and she sets the context for self-care. So just bear with me a moment while I have a look at the book. Caring for yourself to care for others, prioritising self-care. This is the words of Joy Darch. Have you ever wondered why some nurses and midwives do not prioritise self-care when they're so good at caring for others? It's an occupational strength that the nature of those attracted to the nursing and midwifery profession have a desire to meet the needs of others, which attracts those who are often givers in nature. This chapter considers the dilemma for such caregivers to balance care for others with care for themselves when the lives of others are the focus of every day on the job. Working in an environment when the human needs of others are priority and often urgent, it's quite easy to lose sight of your own needs. Have you ever missed a break, become dehydrated during the day, left work hungry and grabbed an easy high-calorie snack before falling into bed exhausted? Sound familiar? Those that support others in times of intense need mostly have a nurturing quality, which is often evident in both work and home life, and it can manifest itself in never putting themselves first with family and friends. Ever felt exhausted when still agreeing to do a favour for someone? Felt guilty when saying no? Listened to a friend's problems for an entire evening without sharing your own worries? As one experienced nurse explained to me, for many, giving in does not come as naturally as giving out. So that was Joy's words. And there's also a great chapter on understanding compassion fatigue and burnout that was written by Dr. Sally Pizarro, a midwife from Coventry University. And her chapter includes a case study with an activity which actually gave me goosebumps when I first read it. It contains a script of an audio artwork entitled Boats on an Ocean. And this piece was inspired by the narratives of healthcare professionals working during the pandemic as they reflected on their experiences. And it was written by writer and director Nick Walker following an innovative arts-based research workshop that Sally hosted with China Plate Theatre as part of the Humans Not Heroes project and the Coventry Creates initiative funded by Coventry University and the University of Warwick for Coventry City of Culture 2021. And all of those scripts are included in this book. The audio itself is accessible by QR code. And if you have the book, I recommend you access this, because as the healthcare workforce, you may well relate to some of these pieces. But I warn you, they do spark some emotions. It wasn't something that I was going to read out. They're quite emotional. Could I have the next slide, please? So we're on section 2 now, which is about managing emotions in difficult times. And this section advances to explore the ways in which ongoing concerns that diminish well-being can progress into more significant challenges associated with mental health issues. And this section is intended to highlight the early warning signs of a deterioration in mental health and offer strategies that destigmatise and encourage an open dialogue amongst nurses and midwives about their mental well-being. And chapters focus on how to manage emotions in challenging times. So understanding our emotions, how to open and start conversations about mental health. I co-authored that chapter myself, dealing with anxiety and low mood. Next slide, please. So this is about well-being needs at different times. It's section 3 of the book, and it's a discussion of the varying well-being needs that impact at various stages of our careers or because of different job-related or lifestyle factors. And it's very much an acknowledgement of the transient and fluctuating variables that can impact on well-being. And it emphasises the importance of certain strategies that are targeted to meet the unique needs of a diverse workforce with different working patterns. So we've got a chapter on sleep work, shift and managing fatigue, and that's coupled with a case study from Newcastle Hospital's NHS Trust about a fatigue risk management strategy that was established in maternity services. There's a chapter on wellbeing needs during periods of fasting, and that's got insights in it from the British Sikh Nurses Association. There's a chapter on mental wellbeing in nursing and midwifery students, and one on wellbeing and late career nurses and midwives. Next slide, please. So section 4 is the biggest section, enhancing wellbeing at work, and this offers examples of factors that enhance wellbeing in the workplace. What can we do about some of these issues? And underpinning this is the creation of psychologically safe work environments where nurses and midwives feel encouraged to share their challenges and raise their concerns. And it's argued that that's the foundation for wellbeing interventions, strategies and innovations to be received by the nursing and midwifery workforce as a valued investment in them and their holistic health. And this section also includes a focus on strategies for self-care and healthy lifestyles, and it concludes with the learning that arose from the psychological impact of responding to the COVID-19 pandemic. So we've got a range of examples for chapters: creating psychologically safe work environments, clinical supervision, developing teamwork and social support in multidisciplinary teams, enhancing health and wellbeing through shared governance strategies, and a chapter on Schwartz rounds and how that can help to manage emotional and social challenges of the job role. We've also got a chapter on supporting distressed colleagues using psychological first aid. And then we move to healthy lifestyle behaviours. So we talk about things like being physically active, looking after oneself, healthy eating, diet, obesity, and the impacts of dehydration and staying hydrated at work. And we conclude with a chapter that I co-wrote on the challenges of health and wellbeing in a crisis that arose from the pandemic. And that chapter is a bit different to the others. It's got a range of case examples of best practice that occurred during the pandemic, providing lessons learned for future crisis situations. I just want to tell you about one example, which is something I was quite closely involved in. So case 2 in that chapter is about wellbeing centres and psychological first aid. So from the early stages of the pandemic, health and care organisations rapidly created respite spaces for the workforce. And in the literature, they're described in loads of different ways: wobble rooms, timeout rooms, wellbeing centres, and so on. And the nature of these spaces, what they're called and the provisions for staff might vary, but essentially they're premised on the assumption that staff need rest, they need recuperation, they need a place where this can happen, and that needs to ideally be outside of their clinical area. And these sorts of spaces are intended to encourage people to take work breaks, provide quiet spaces for relaxation, areas to eat and drink, and opportunities to socialise with peers and access support, albeit it was with physical distancing during the pandemic. But I just want to give you a really nice example of this, because in the UK, Nottingham University Hospital's NHS Trust really led the way with staff wellbeing support in the early weeks of the pandemic. 2 wellbeing centres were set up in April 2020, providing high quality rest spaces and peer-to-peer support, psychological support from staff volunteers called wellbeing buddies, who were trained in psychological first aid. And these centres were open to all staff from any job group, including nurses and midwives. And at the University of Nottingham, we led the first evaluation of the implementation of supported COVID-19 staff wellbeing centres globally. And these centres were really highly accessed. So over the 17 weeks of the first wave of COVID-19 in the UK, we recorded almost 15,000 facility visits across the 2 facilities in a single trust. And we did some qualitative research, some interviews that showed that wellbeing centres and access to psychological first aid was really valued by the staff, who viewed these provisions as critical to the wellbeing of hospital employees during and after the first surge of the pandemic in the UK. And the impacts were wide-ranging. So attendees of the wellbeing centres reported loads of benefits for individuals, their personal wellbeing, for teams, team cohesion and social support, the healthcare organisation, the potential for this wellbeing intervention to prevent sickness absence through timely support and giving people that time out, and also an impact on patient care quality through improved individual team wellbeing, supporting productivity and compassionate care. And our research highlighted the importance of managerial support, actually, and role modelling in staff wellbeing service access, because staff told us that they were more likely to access these centres and psychological support if they felt it was sanctioned by their line manager, or even better, role modelled and advocated by managers and colleagues. Although we've got loads to learn from the rapid implementation of these sorts of facilities for health and care workers during the pandemic, it should be emphasised, as it was earlier by Sue, that rest and recuperation and access to psychological support and self-care is essential elements of supporting staff wellbeing always, and not just in a crisis. And we end this book with our final chapter commenting on the future of health and wellbeing at work. And again, that was one that I co-authored. So just to summarise, throughout the whole of this book, we take you on a journey that starts with the business case for why organisations should invest in the health and wellbeing of their workforce. Why should a trust put money into this? And embed wellbeing into their organisational policies and practice. We introduce some key areas of health and wellbeing and provide strategies for the actions that we can all take to maximise physical and mental health and support the wellbeing of ourselves and others. And we discuss health and wellbeing in the specific context of the nursing and midwifery role across the whole professional career, from students through to senior leaders, even through the most challenging of times, like a global public health crisis. And at all times, we ask the reader to think a lot about the issues raised in our chapters by engaging with the activities involving reflecting or planning. And through all of the case studies, we want to inspire readers by showcasing innovations implemented by individuals, teams or organisations across the health and care sector, with ideas that people can go back and model in their own trust. And our hope is that readers will use this information to make a difference where they work or study. Individual people, we're not just passive recipients of health and wellbeing initiatives. all of us play a really key role in creating and sustaining environments where people feel supported and can flourish. And we hope that this book is going to help nurses and midwives to advocate wellbeing and improve the working environment for themselves, for peers, for patients and clients.